স্টুডেন্টস ওয়েলকাম টু অল আবার নার্সিং চ্যানেল। সো আজকে ভিডিওটি ডোজ ক্যালকুলেশন নিয়ে। সো ডোজ ক্যালকুলেশন দেয়ার ইজ ভ্যারাইটিস অফ ফর্মুলাস আর দেয়ার। সো for in case of by the body weight, if we calculate the dose of the patient, so like example, if doctor advise the dose of patient is 40 mg per kg, we have to give the medicine like erythromycin should be given to the patient like 40 mg per kg as per the physician. So how we calculate the dose? So by the weight, like if the patient's body weight is 50 kg, so we simply multiply the mg into kg, like 40 mg into 50. So 1 kg, for 1 kg we have to give 40 mg. So for 50 mg we need 50 into 40, that is 2000 mg, right? So by this way, it is the simplest method by which we can calculate the patient's dose of medicine. Just multiplying the patient's body weight with the recommended dose per kg. Okay, recommended dose per kg is 40 mg, which is written by the physician per kg 40 mg. So for 50 kg, 40 into 50, that is 2000 mg. That is the easiest method. Next, we are going to know the continuous infusion dose. So if a patient who needs continuous infusion of medicine, so in that case, how we calculate the medicine dose? So suppose the formula is desired dose into 60 divided by drug dose in mcg. The formula is desired dose, means the dose which is prescribed by the doctor, that into means we need to give the patient, that is the desired dose that we want, into the 60 is the drop factor constant divided by drug dose in mcg. Okay, so desired dose, like the doctor advised the patient for giving 12.5 mg of medicine. So 12.5 into 60 is the drop factor divided by drug dose, means means like তোমার কাছে একটা ভায়াল আছে বা অ্যাম্পুল আছে যেখান থেকে তুমি মেডিসিন নিয়ে তুমি পেশেন্টকে মেডিসিন দেবে। সো ইন হ্যান্ড তোমার কাছে কত এমজি বা কত ডোজের মেডিসিনটা তোমার কাছে আছে। সো ইন ভায়াল বলো বা অ্যাম্পিউলে বলো বা যাতেই বলো না কেন, পেশেন্টের মেডিসিনটা তুমি ইন হ্যান্ড কত ডোজে তুমি কন্টেনারের মধ্যে পাচ্ছ, দ্যাট ইজ দ্য ড্রাগ ডোজ ইন এমসিজি। সাপোজ ফিউরোসেমাইড আর ল্যাসিক্স আমরা পাচ্ছি সাইজ, সাপোজ ধরো তোমার 20 mg তোমাকে ল্যাসিক্স দিতে বলা হয়েছে। সো তুমি 20 mg যদি তুমি দিতে যাও, সো হাউ ইউ উইল ক্যালকুলেট দ্য ডিজায়ার্ড ডোজ 10 ইন্টু 60, দ্যাট ইজ দ্য ড্রপ ফ্যাক্টর ডিভাইডেড বাই ইন হ্যান্ড তোমার কাছে কত ডোজে মেডিসিন ভায়াল বা অ্যাম্পিউল তুমি পাচ্ছ। তো ল্যাসিক্সে আমরা অ্যাম্পিউল পাই, যেটা তুমি হচ্ছে 2 ml 1 ml পাবে। 1 ml ইকুয়ালস টু, তো 2 ml ইকুয়ালস টু 20 mg, 1 ml ইকুয়ালস টু ল্যাসিক্সে 10 mg। ওকে, সো ইউ হ্যাভ টু রাইট দ্যাট মিনস ইন হ্যান্ড, আর তোমার কাছে যে ডোজটা রয়েছে সেটা হচ্ছে, তুমি যদি 1 ml ভায়াল নাও তাহলে 10 mg। সো আমাকে 10 mgটাকে হচ্ছে এমসিজিতে কনভার্ট করতে হবে। ওকে, সো 1 mg ইকুয়ালস টু 1000 mcg। সো 10 mg ইকুয়ালস টু কত হবে? 10 mg ইকুয়ালস টু হবে 10 ইন্টু 1000, মিনস 10,000 mcg। সো ইউ হ্যাভ টু ডিভাইড দ্য ড্রাগ ডোজ, মিনস ইন হ্যান্ড তোমার কাছে কত পাচ্ছ তুমি, সেটা হচ্ছে তোমার 10,000 mcg. So by this way we got the dose, patient's dose, which is continuously patient is taking. Next, another one, that is max calculation. This is done in case of patient who are taking the continuous infusion of medicine. So in that case, in per minute patient, how much patient is taking the medicine, that we calculate by this max calculation. Per 1 minute patient, how much dose of medicine is patient taking, that is calculated by max calculation. So this max calculation you can see in the critical setting. In that this formula is used to calculate how much dose is patient is taking in per minute. So for this the formula is ml per hour into concentration into 1000 divided by body weight into 60. 60 is the constant for adult drop factor. So for adult the drop factor is 60. So ml per hour means which is prescribed by the doctor, that is needed for the patient per hourly, that is by the infusion pump or the So by the syringe pump, we provide this medicine. Like if the patient, we know that patient in the critical care setting, there is inotropes like adrenaline, noradrenaline. Those type of medicine is continuously patient is taking. So in that case, if the patient is advised for 2 ml per hour, like 2 ml per hour, patient have to give in the inotrope like adrenaline should be given. So in that case, how much dose of medicine patient is taking in per minute, that is calculated by max calculation. So here, like 2 ml per hour, which is prescribed by the doctor, that adrenaline should be given to the patient 2 ml per hour. So this should be written in the ml per hour, that is 2. Okay. Into concentration is what? Like in how much solution you dissolve the medicine. Like in 50 ml solution, you dissolved 2 mg of adrenaline. Okay, we know that 1 ml adrenaline contain 1 mg, right? So concentration is what? That how much medicine you dissolve in how much solution. Okay, so that should be written in the concentration. So for adrenaline, the concentration is 2 by 50. Means in 50 ml of solution, we mixed 2 mg of medicine. Okay, into 1000. 1000 is a constant, divided by body, patient's body weight. Like patient body weight is 60, as for example 60 kg, into 60 is a means drop factor, which is constant. So by this calculation, we got the answer in mcg per minute. Means patient is taking that much mcg of medicine in 1 minute. I think you will be understand that this is the prescribed by the doctor, that that much of medicine that patient should be taking in 1 hour, that is 2 ml per hour, 12.5 ml per hour, 5 ml per hour, 7 ml per hour, anything that should be written here, into which is multiplied by the concentration. Concentration is in how much solution you dissolve how much medicine, that is the concentration, into 1000. In case of adrenaline, that is 2 by 50. So according to that, you have to calculate the concentration into 1000, the constant, into divided by 60. 1000 is given for the mcg, to get the answer in mcg. So 1000 is for nothing, to get the answer in mcg form, divided by 60, that is a patient's body weight, that can be 70, 80, anything. Body weight into 60 is a drop factor. By this by this calculation, we got the answer in mcg per minute. Means that much of mcg a patient is taking in 1 minute. Okay, that is the max calculation. Next, coming to the drop factor calculation. So in case of adult, like patient is advised 600 ml of NS for 6 hours. It is written. So by this, we have to provide the means fluid to the patient. So in that case, the formula is the amount of fluid total. Okay, the total amount of fluid multiply into the drop factor divided by total time in minute. So that is the formula. Total amount of fluid into drop factor divided by total time in minute. Suppose in case of patient that I given in example, 600 ml of fluid, which is given in 6 hours of time. 6 hours should be, this we have to multiply the hours with the 60. By this way, we got the answer in minute. So to convert the hour into minute, we have to multiply into 60. We will multiply the 60. And the drop factor for adult, the drop factor is 60. Okay. So for the adult, the drop factor is 60. Sorry, there has to be multiplication of 20. The drop factor, drops per minute. So we have to calculate the drop. So drop calculation in that case, that is also called the drop. So for drop calculation, the formula is total amount of fluid into drop factor divided by total time in minute. So as for example, যদি আমরা ধরি যে 600 ml of NS in 6 hours, যদি বলা হয় যে 600 ml of NS 6 ঘন্টা ধরে দিতে হবে, সেক্ষেত্রে আমরা কীভাবে করব যে কত ড্রপ পার মিনিট যাবে। তো সেম এই ফর্মুলাটা ইউজ করব। টোটাল অ্যামাউন্ট অফ ফ্লুইড কত আছে এখানে 600 ইন্টু ড্রপ ফ্যাক্টর। ইন কেস অফ অ্যাডাল্ট দ্য ড্রপ ফ্যাক্টর ইজ 20. The drop this in case of adult the drop factor is 20, which is constant. In case of pediatric the drop factor is 60. Okay, because the 20 is due to that fluid is given through the adult drip set. Okay, that we all see in the for the NAs or RL we give the by which set IV set we given, that is a macro drip set, which is called macro drip set or adult drip set. And pediatric drip set, that is called pediatric drip set or micro drip set. In that case the drop factor is 60. So if we use the micro drip set, in that case the drop factor will be 60. In case of if we use the macro drip set, in that case we use the drop factor is 20 divided by total time, that is 60 hours into, I already told we have to write the time in minute. Okay, so 60 hours 6 hours is there, so to convert the hours into minute, so we have to multiply it 60. To convert the hours into minute, so we have to multiply 60. So by this way we got the answer. So this is 100. So we got 100 by 3. 33.33 something. So if we write it 34. So 34 drops per minute we give the drops to the means the person. So the patient should be getting 34 drops per minute. So per minute patient is getting 34 drops of fluid. So by this way we can calculate the drops per minute. So any amount of fluid that should be written here. Then the drop factor, that is for adult drip set, that is 20. In case of pediatric drip set, micro drip set, the drop factor is 60 divided by total time in minute. Total time is 6 hours. I gave in the example 6 into 60 to convert the hours into minute, that is 60. So by this way we got the answer. So in case of same pediatric, like if there is given 400 ml of NS for 8 hours, 8 hours, like in that case formula is same. Total amount of fluid 400 ml into drop factor. So drop factor will be changed because in case of pediatric we use the micro drip set. So in that case the drop factor will be 60. Next the total time it is written 8 into, that should be converted into minute. For that you have to multiply 60. So by this way we got the drops per minute, like 60. So it should be calculated like a 50. So 50 drops per minute. So we have to administer the patient, the pediatric child is getting the dose of 50 drops per minute of fluid. Okay, so by this way, this formula we can calculate any amount of fluid, how much drop patient is taking. So thanks for watching. If you like the video, please do like, share and subscribe to my channel.